Hi again, welcome back to Mediplacebo. In this video, we'll be studying about endometriosis. So, before knowing endometriosis, we should have an idea about the anatomy of the uterus, that is, the external layer, which we have is the perimetrium, which is this thing. Then we have the myometrium, that is made up of smooth muscles, which is the middle layer, and the outermost is the endometrium, which we have, or the innermost, depending on the lining of the cavity. So the endometrium is made up of simple columnar epithelium, and endometrium is the layer in which we tend to find the pathology, that is endometriosis, whereas in myometrium is the pathology where we tend to find the pathology known as fibroids. So endometriosis is the painful menses which is cyclical and severe in nature. It is usually due to the extrauterine endometrial implants, that is outside of the uterus. The endometrial lining of the uh, uterus, that is, it could be either the glands of the endometrium or the stroma of the endometrium. If it is present outside of the endometrial cavity, that is called as endometriosis, and usually it sheds along with the menses, and while shedding with the menses it causes the intraperitoneal irritation, since the implants mostly could either be in the region of the peritoneum or in the region of the ovaries. If the implants are to be found on the peritoneal layer, then while shedding uh, the endometrial lining during the period of menstruation, it could lead to the intraperitoneal irritation and hence leading to the painful menses. Um, Also, it can involve the superficial peritoneum and the micro, and the finding which we have is called as the yellow brown powder burn lesion. And when it involves the ovaries, it is the blood filled chocolate cyst called as the endometrioma. So as the endometrial implants can also spread to the bowel serosa and may present with symptoms of constipation, dyschezia, diarrhea, uh, abdominal pain, and constipation. And when the endometriosis uh, is spread to the uterosacral ligament, that is the ligament supporting the uterus to the connecting the uterus to the sacrum, which can be seen here in this diagram as well. If the endometriosis spread to the uterosacral ligament, it would lead to the retroversion of the uterus, which normally is anteroverted and anteroflexed. So this was some general summary, and then the causes are like retrograde menses, blood vessel lymphatics, metaplasia of remnant progenitor cells. So these are the common causes of endometriosis. The usual presentation of endometriosis would be basically like a premenopausal woman who comes to the clinic with the diagnosis of endometriosis. Uh, so they would have a normal premenopausal levels of GnRH, but high levels of FSH and estrogen, and usually we start them on treatment like leuprolide, so that we could decrease the levels of GnRH, FSH, and the estrogen eventually. So to understand this, we need to understand the concept of hypothalamus, GnRH, FSH, LH, and estrogen, which plays a role in the cycle. So we have the hypothalamus, that is giving the positive feedback for GnRH, and eventually GnRH would stimulate the anterior pituitary to uh, produce FSH and LH. FSH and LH, after acting on the ovary, it would stimulate the release of estrogen. This increase of estrogen would act as a negative feedback mechanism on both the anterior pituitary as well as the hypothalamus to decrease the GnRH and eventual decrease in FSH and LH. If there is decrease FSH and LH, that would eventually decrease the levels of estrogen. So in endometriosis, since there is increase in the levels of FSH and estrogen, and could be increase GnRH or could be normal GnRH, uh, we tend to treat them with drugs like leuprolide, which are which can be given either in continuous, that is an intramuscular depot form, that would lead to decrease in GnRH and decrease in FSH and estrogen. So if we understand the leuprolide drug, that is when it is placed in a female's body as an intramuscular depot, initially it would tend to increase the FSH and LH levels, uh, and that would eventually increase estrogen, uh, but eventually it would decrease the levels of FSH and LH and eventually decreasing the estrogen level. Whereas if the same drug is given in a pulsatile fashion, that is in between intervals of, that is in between uh, keeping an interval, that would lead to an increase in GnRH and eventual increase in FSH and LH and eventual increase in estrogen. Some other drugs which the leuprolide could be confused with is drugs like letrozole. Letrozole is the class of aromatase inhibitor which prevents the conversion of estrogen, that would lead to low estrogen. And for the low estrogen, as we saw here, the low estrogen would eventually be detected by the body, and there would be higher levels of FSH and LH to increase the production of estrogen eventually. So it can be understood with the similar concept of menopause in which we have less estrogen. So the lesser amount of estrogen would lead to the higher would lead to the secretion of FSH, and these increase in FSH and LH in the body would lead to the symptoms like uh, hot flashes and increased sweating, that are the common findings in postmenopausal women. Some other drugs which are used in treatment of fertility are drugs like clomiphene citrate. It is a selective estrogen receptor modulator or a SERM that will block the effect of estrogen and will stop the negative feedback which it has on FSH and LH, that would promote more release of FSH and LH, and that would eventually increase fertility. It is used in treatment of infertility. The other drug which we have is Danazol. Danazol is an exogenous steroid. The other one which we have is flutamide. Flutamide is an androgen receptor blocker that will stop testosterone, dihydrotestosterone having an effect. So basically, it will prevent androgens from having an effect on testosterone and dihydrotestosterone receptor. It is usually used in the treatment of prostate cancer. Uh, the last drug which we have is finasteride, which is the 5 alpha reductase inhibitor. So both flutamide and finasteride have a similar end result, that is to decrease the level of testosterone. So I think we covered all the drugs relevant to the female reproductive which we have in use, along with the concept of endometriosis. And the findings here are important in terms of licensing exams, which could be asked: the yellow brown powder burn lesion, which is involving the superficial peritoneum, whereas if it endometriosis involves the ovaries, it would be blood filled chocolate cyst endometrioma. So that is it for this video. If you like the video, please like, share and subscribe, and if you have any doubts, please let me know in the comments below. Thank you.